if I have been on multiple seizure medicines and I currently take more than 2, should I be evaluated for brain surgery for my epilepsy? I'll throw this out to anyone.
Yes, they
Yes.
should. If they fail 2 meds at proper doses, they should be evaluated for a brain surgery. Now, when we say evaluate, that means usually figuring out where the seizures are coming from. If it's a generalized epilepsy, then they're not a surgical candidate. If it's a focal epilepsy or a multifocal epilepsy, then they could be a surgical candidate. And when we say surgery, you can start with brain surgery if it's very focal and it's a straightforward surgery. A lot of patients get a VNS as well if it's, multifocal or if it's generalized epilepsy.
From my surgical epilepsy experience, so the one thing, if epilepsy is focal, the chances of finding the area where the epilepsy is coming from are high. On the other hand, if the epilepsy is lesional, then the surgery, the success of surgery will be more. And also it depends on where. For example, the temporal lobe epilepsy, the surgical success will be high. On the other hand, frontal also a little bit high. Parietal lobe, it's so thickly connected to rest of the brain, so chances will be a little bit low. Occipital lobe, surgical options are limited because the area is so important because of the eloquent cortex, because there is always a risk of losing vision. So we are a little bit reluctant with the occipital lobe. We go with the other options called neuropace.
I agree with all of them. So, it's also a very complicated question. Some patients may not respond to medications just because their epilepsy is resistant. So we call that drug-resistant epilepsy when they are resistant to 2 drugs. Some patients may actually have an incorrect diagnosis of epilepsy also, and they don't respond to medications, and they continue to have seizures. What are called seizures may not actually be epileptic seizures. So, when they fail 2 medications, they should basically go back to their epileptologist and get reassessed. They should second question the diagnosis, check it again, confirm the diagnosis. If it's indeed epileptic seizures, and they have been on 2 drugs at maximum doses, then I think that's the spot. That's the point to start talking about epilepsy surgery if they are the right candidates.
And one more thing I'll add to that is, sometimes if and 2 medications, you're right, and that's why it's really the definition makes sure it says 2 appropriately tried medications, which means for the right epilepsy syndrome. So if someone has generalized epilepsy and you can try oxcarbazepine is for partial epilepsy. So that's where you then want to make sure that a right medication was tried before you call it. So yes, after 2 you can do it. Could you try? So I would say, always say take a second opinion. That's what I said. I would do what I would do for my family is I would take a second opinion from somebody else and say, hey, are these the right medications? Then the first question the neurologist, epilepsy trained doc, as Dr. Mehfoo said, is you want to go to someone who is trained with epilepsy or experienced with epilepsy. Nowadays, even once you do enough experience, then you are pretty good. So, and if I have enough experience with epilepsy and I say, oh, this was not the right medicine because your EEG is showing so and so, and we change the medicine, boom, that's an easy fix. Why go in for a brain surgery? But yes, if you continue to remain intractable, then you got to explore the non-medication management techniques, and surgery would be one. Vagal nerve stimulator is one, because some patients feel more in control when you have a VNS. You can swipe the magnet, stop the seizure, versus going for a big brain surgery, because brain surgery is always an option, but maybe the VNS will control it. And then diet changes. So all these things, combination, you could do some of that. The ketogenic diet is granted, ketogenic diet is tough, but maybe even if you go with modified Atkins or something as close as you can get, reducing the carbs and increasing your protein intake and some fat intake, I've seen that also makes a huge difference. Reducing a potent antioxidant diet makes a difference.
Excellent points.
Yeah, I think a failed second drug trial, and again, making sure that you chose the drug appropriately and don't include drugs that were discontinued because of side effect issues, should lead to kind of what I call outside the box thinking. And that includes epilepsy surgery, vagus nerve stimulator, DBS, and neuropace devices, also the ketogenic diet and its variants. And I put Epidiolex in that outside the box area. That's at least the way I approach it with my patients. But I think you fail 2 drugs, you really need to look at all other options.